We just had the chance to speak with Priyanka Jain, who's the CEO and co-founder of Evvy. Wow, she has
A
energy, she has
whirlwind.
passion, she has information. She is really doing things that have the potential to shake up our understanding of women's health.
Yeah. You know, people talk about AI and machine learning, and they get really nervous about what that might entail as it relates to healthcare in general. But wow, is she putting the knowledge and data to good work to really help with real life clinical situations by studying the vaginal microbiome. Can't wait for you all to hear about this.
Well, one of the things that struck me about the way she speaks is she takes very complex concepts and makes them understandable. And I always say that when you're talking about anything medical, you take a whole complex series of information and you communicate it in a way so people can actually understand. And I've always been, a big proponent of making sure we have the language to have a conversation. So you
Thank
have,
you.
you have that in common. So let's take a listen.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited to have Priyanka Jain with us today, the co-founder and CEO at Evvy, and probably the person most responsible for bringing the conversation about the vaginal microbiome to the fore. How are you?
Good. Thank you so much for having me. I am incredibly excited to be talking to two of my favorite people in the women's health space.
Well, thanks so much. We would love, lots of people have heard the story of Evvy, and we want to share it with a whole lot more. How did you get here? Where did the idea come from? Tell us about sort of the brainstorm.
Of course. I mean, this means you don't wake up thinking about the vaginal microbiome every day the way I do. So,
Well, the three of us probably are unusual. We'd be more likely to than most other people.
But yes, absolutely could tell you a little bit more. I mean, I think as most founders of women's health come with some personal story. I think I always joke that I was a patient of the healthcare system one too many times, having a female body. I was the person who went to every doctor and was, having all these symptoms, all these issues, and was constantly told to drink more water or sleep more, or maybe I had too stressful of a job. And I just could not believe. And for context, my background's in data science and machine learning. And I was like, how in the world can we sit here and predict anything going on in the world, except for if it has to do with the female body? And then hands go up and we're like, we don't know. And obviously that's an oversimplification. Dr. Dweck, you do probably much better than what I experienced.
You know what? I'm in full on agreement with you. So roll on.
But it was incredibly frustrating to me. And that was when I found out that women weren't required in clinical research in the US until 1993, that women to this day are diagnosed 4 years later than men across over 700 diseases. And I was just like, oh, like this is not a me problem. So that's nice to know. And there's so much opportunity. Like there's so much data that we just don't have on the female body. And like, wow, there's probably so many signals that our bodies are constantly giving off, trying to tell us like, I need help or I'm doing great. But we're just not measuring or tracking any of those signals because we never studied women. And we essentially assume that whatever was predictive of health and disease in middle-aged, mid-sized white men is also what's going to be predictive of health and disease in women. But what if there are unique signals that we're not measuring? Could those be an opportunity to improve health outcomes in women? And so that was what really we set out to solve at Evvy. And like you said, our first focus is on the vaginal microbiome. And for anyone who doesn't know, there's kind of two interesting sides of the vaginal microbiome, if you will. And Dr. Dweck, I think you are actually an expert on this as well. So excited to hear your additions to this. But on one hand, vaginal discomfort is the leading reason that women seek healthcare advice in the US, right? Incredibly prevalent. Depending on the studies you look at, it's something like 30% of women at any given time have a vaginal microbiome in dysbiosis. It's the number one type of OBGYN appointment.
Yeah.
And what's so infuriating is then we go to the doctor and we are more likely to be misdiagnosed than correctly diagnosed. And we are more likely to recur our infections and not get better than to get better. And so you basically have this incredibly prevalent, but very poorly managed condition affecting so many women. Dr. Dweck, correct me. Do you have anything to add to that?
I would say that is a big bulk of my practice. And you know what? Of course, I get the frequent flyers who are coming back over and over and over, super frustrated, frustrating me as well. And, it's tough to find a solution.
Exactly. So that's one side of it. And then what blew my mind is that on the other side, there's so much research showing that what's going on in the vaginal microbiome is not just affecting vaginal health and vaginal symptoms, right? Having a healthy vaginal microbiome obviously makes it less likely that you have symptoms and infections. But then there's so much research showing that having a healthy vaginal microbiome can also improve outcomes in fertility, IVF success rates, reduce preterm birth rates, or reduce cervical cancer progression rates or STI acquisition rates. And I just could not believe that for the leading reason women go to the doctor and for something that could improve outcomes in so many areas of women's health, that we didn't have large scale data on this and that nobody was using this data to make better healthcare decisions.
So before you jump into the data, just explain to those people who don't wake up every morning thinking about their vaginal microbiome, actually what it is.
Is such a good question. Okay, so I'm sure most people have heard of the concept of a microbiome, right? It's a community of bacteria and fungi and viruses that live in or on some part of your body. Most people have probably heard of your gut microbiome. There's also one on your skin, in your mouth, in your vagina. And the one in your vagina is actually playing a very interesting role in our health. So essentially, when your vaginal microbiome is in a healthy state, if you will, it's dominated by protective bacteria that are providing these really interesting immune-like functions for the rest of the reproductive system. Specifically, they're releasing lactic acid, hydrogen peroxide. They're taking up space on the vaginal wall and making it so that inevitably when pathogens get into your vagina, because think about it, it's essentially an open canal between the outside world and the rest of your reproductive system. When your vaginal microbiome is healthy, it's actually keeping those pathogens out naturally because it's too acidic, they can't survive, and there's no space for them, right? But I always say, God forbid, you have sex with someone new, you sit in your swimsuit for too long, you have a long period, all of these things can elevate your vaginal pH. Those pathogens can start to replicate. And what you start to see is that we start going to the doctor, we start having these symptoms and these infections. And then you have the healthcare experience that we described. But what we're not taking into consideration is that we've also lost that barrier, right? And so when we throw an antibiotic at it, we still don't have those good microbes protecting the rest of our reproductive system. And I think the vaginal microbiome is this incredible tool that we have to improve our health outcomes, but is not something that we really pay attention to today.
I have to laugh. You're speaking in such amazing scientific terms, but totally understandable to a layperson who knows nothing about it. And I know that in my office, sometimes we describe it as the self-cleaning oven because the vagina really has those mechanisms. So I just find it funny that these ways of communicating this are juxtaposed in this way.
Totally. No, that's so well said. And I think people don't understand what that means. And it's
So now that we know this and you haven't discovered it, but you're bringing light to it, what are you doing? What is Evvy and how are you creating a company to be part of the solution?
Yeah, absolutely. So what Evvy essentially is focused on the vaginal microbiome today. We're looking at novel markers of health and disease that you can find in the vagina. The way we're doing that is we provide patients and providers with the first ever at-home test that does metagenomic sequencing on the vaginal microbiome. So we look at the whole genome of all bacteria and fungi that are present, and we help patients and providers get a full comprehensive view of everything going on in that patient's vaginal microbiome. And it's a clinical test, it's certified, it's physician ordered, physician reviewed. And now we've actually served over 70,000 patients with that product. And we've built the world's largest and most comprehensive data set ever on the vaginal microbiome. And so now when a patient comes to us, we don't just say, you have bacterial vaginosis. We're able to say, interesting, you have this combination of molecular signatures, you have these symptoms, you're in menopause, you're on this medication. These are patients that look like you, and this is what we predict is most likely to help you get better. And so what we do now is we not only can give you the test and the information, but we can also then actually predict the treatments most likely to help you, and then prescribe custom compounded vaginal suppositories with exactly what is most likely to help that patient get better. And now,
yeah. My head is spinning because I've got like 4 million questions on my mind.
please.
But I just have to ask, because we talk about communities of microbiomes in my world and in your world, obviously, where different women of different ethnicities or with different lifestyles or whatnot really have a very predictable type of microbiome with certain organisms that are dominant. And I'm sure that your data has shown this and confirmed this. But what is it that, this is a moment in time when you get tested. So how do you jump from, okay, this is what my microbiome looks like today, but tomorrow I'm menstruating, or today I'm using vaginal estrogen, or I just took an antibiotic for my pneumonia. Like, how do you interpret all of this? Because testing is so variable.
Yeah, such a great question. So first thing is that when we look at the microbiome, we actually contextualize it in those things. So we ask you what day of your cycle you're in, because we can actually normalize results based on where you are in your cycle. There are very predictable changes that happen both from the presence of menstrual blood as well as the changes in hormones throughout the month that allow us to say, okay, it's actually predictable that you would be higher in lactobacillus inners right now and lower in crispus. And we have a feeling that if you tested 2 weeks later, they would actually look slightly inverted in those numbers, right? For example, if it is somebody, first of all, we always tell patients not to use the test within certain periods of time of certain treatments, so that we're not just, if you put a vaginal probiotic in and you take a swab, you're essentially just swabbing your probiotic or you're swabbing your antibiotic. So we try to, make sure that patients are testing at a time where they're not getting useless results. But then the beauty of the microbiome changing is that then when you do something, you can actually see if it works, right? So you can say, okay, if I'm going to use these treatments, or I'm going to change my sex behaviors, or I'm going to change my diet or my lifestyle, you can actually close that feedback loop for the same reason that you described earlier.
Very interesting. Very interesting. In regard to how you are treating, like what's the call to action when you get a result? So for example, in my practice, I'll see someone who has a yeast infection, but it won't go away, or it just keeps returning after traditional treatment. Do you check different strains? Do you check resistances and sensitivities? How do you manage that type of thing? This is a terribly frustrating trouble for both patient and clinician alike.
100%. So what you just described is exactly what we do. So we look at all possible strains of bacteria and fungi. So for example, you might have Candida albicans, which might respond well to a certain antifungal. But if you have Candida glabrata, that actually responds better to a different type of treatment. But most tests aren't looking for the difference between those things. Similarly, we often find that there's co-infections. So people think it's one infection, but it's actually two. Go ahead, Rachel.
But I think that's such an important point. It's not binary.
Absolutely.
The presence of yeast or not, you're going to one level deeper to say, all yeast aren't created equally, kind of thing.
100%.
And we do this in office, without such a fancy test, but it takes days to come back. So somebody will suffer for quite some time. I don't know what your turnaround time is, but this is great to hear.
Well, totally. And I think that looking at it's what you were saying about the community of the microbiome is so important, because the challenge with, this extremely well, the current standard of care, which I don't think you're doing this today, but unfortunately,
I promise you she's not. Every time we finish a
current
call,
standard
people
of care
call and say, can she be my doctor?
is the AMSL criteria, right? Where literally doctors are looking at shapes under microscopes, smelling swabs. We are in the 18th century in the standard of care.
You got that right.
But then we do have PCR tests that will tell you, okay, I'm looking for this very specific pathogen, this very specific microbe. Is it present, right? That's great. You can get those types of tests, thank God. The problem, though, is that overall, what you're looking for is, are you dominated by the good guys or not, right? Because when you think about someone's overall health, the likelihood that their infection's going to come back or they're going to have a positive health outcome, you want to know the community. You want to know, are you 5% pathogens? Are you 95% pathogens? Because then we can take a much more specific approach to how we're going to treat that. How much do we need to focus on rebuilding the good? What's the right targeted antibiotic? And like I was saying earlier, it's not usually just one pathogen or one infection. It's a whole community that you're trying to shift. And that's a very different, it's like, you're not just trying to pull out weeds. You're trying to I don't know. I'm not a great gardener, so maybe this is a bad analogy. But
the landscape architect is what you're trying to do.
You're trying to grow a totally different garden, right? And so I think it's just a different approach, if that makes sense.
Here's today's hot flash. 53% of women say they have never heard of vaginal microbiome.
So from a business perspective, do you then have 3 streams of revenue, the kits, the products, and then ultimately the data?
Yeah, it's a great question. Exactly. And I think beyond just the data itself, our goal is not to sell the data. I don't think that's a very interesting business model, to be honest. I think that what's really exciting about Evvy is that we have an opportunity to help, obviously, patients and providers dealing with vaginal health issues. Great. What's also exciting about Evvy is the ability to expand into the indications that are implicated by the vaginal microbiome. So things like fertility, things like pregnancy, things like cervical cancer progression or menopause care, where using our exact same platform of measuring the vaginal microbiome and modulating it, you can then improve outcomes in these other areas. And I'm sure you all are familiar with payers in the United States who don't love to cover vaginal health. They are interested in covering, reducing preterm birth rates or reducing cervical cancer progression rates. So I think there's an exciting kind of evolution of our business where we'll be able to show that what we do in vaginal health improves outcomes in these secondary areas, and that unlocks kind of new revenue, high value reimbursement. That's number two. And then the third is the data. But to be more specific, instead of selling the data, what we're really interested in is identifying novel insights from our data that we can use as targets for new treatments, for new diagnostics. And LabCorp is actually one of our strategic investors, and we're working with them on, can we identify novel markers for things like endometriosis, PCOS, pelvic inflammatory disease? And then can you have something as simple as an at-home vaginal swab that could give patients way more answers than they're getting today?
How are you involving the patient's typical practitioner, or are you relying on your own? This is something I'm always asking. We don't want to be left out of the loop, but we also don't want to be presented with this litany of information that we don't know how to manage.
Great question. So there's two different answers to that. One is if a patient has a provider that they love, who does want to deal with this information, who is interested in it, we actually have over 1,000 doctors across the United States that order Evvy tests for their patients. They get the results directly. We provide them with full results interpretation, recommended next steps based on our data. They get kind of an enhanced provider experience, and we have many providers who do that today. Then for a lot of patients who don't have a doctor for whatever reason, right? Maybe their doctor doesn't believe them. They can't get in to see their doctor, you name it. We do also have providers on the Evvy platform who can see patients all the way through.
One more clinical thing that really strikes a nerve for me is the view on probiotics. And if you have a view on it, your view on oral versus vaginal. And because there are loads of skeptics in my world. And just curious on your thoughts.
Yeah, I mean, I would love to hear your thoughts too. I think that here's my opinion that I would say to my own friend, to myself, to my mom, to my sister. I would say that there is enough research to absolutely say that most of the time it seems to be helping. And logically, if you think about it, the problem that you're trying to solve is you're trying to get to a state of being dominated by healthy bacteria. Supporting your body and giving it more of that healthy bacteria, feeding that good bacteria, makes a lot of sense to do. Have there been the perfect studies that show that this is the absolute gold standard? We know exactly the regimen, we know the dose, we know how it differs between people? No, because guess what? We live in America where we don't fund women's health research, so how are we ever going to have that answer? But I don't think it's fair to say to all these women who are suffering, ignore all of this data that exists. It's absolutely useless, because I think something that frustrates me so much, and I'm sure you see this all day, every day, is that we don't distinguish between things that are not well studied and things that are proven not to work, right? And I would say that probiotics go in the first bucket, and I think there's more research every day showing it's useful, it's useful, it's useful. And frankly, we see this in our own data. A lot of our providers prescribe oral and vaginal probiotics, and we see much, much improved outcomes compared to the standard of care. And so I think the data is coming, and I think that women deserve to have the choice to understand how well researched it is and then decide what they want to do.
Really well said. Absolutely.
Alyssa, as a practitioner, what we hear oftentimes from patients is the doctor says, as it relates to probiotics or supplements or other things that don't have, as you say, the perfect studies, double-blind, placebo-controlled, it can hurt.
Totally.
You can try this supplement or you can try this probiotic. It can't hurt.
That is a loaded statement, because actually some supplements actually can hurt depending on your individual situation, specifically people on blood thinners or who might have liver problems or kidney problems. So I would hate to make a blanket statement like that. But for the most part, I mean, probiotics do seem to have way more potential benefit than risk, except in special populations. And I think those people probably know who they are or could check in with their HCP for that. I just wondered if that was sort of your end game, like we're checking all of this microbiome information and data, And really the point is to find probiotics that will rebalance whatever your issue is. And I just know there are so many skeptics in the medical world, so I just wanted to hear your answer on that.
Totally. No, it's a really great question. And I think I would love, we actually just submitted a publication on our data and I'm excited. I think just more data needs to come out, right? I mean, we serve 70,000 patients. Nobody's looked at 70,000 people's vaginal microbiomes and said, these are the treatments they're using. This is what works. And I think we hope to put more data behind these things that so many women know work for them. And I think it's unfortunate that the answer is always, you know, don't try it. There's not enough research instead of saying the research.
You know, there are other, oh, I'm sorry, just wanted to ask, what really distinguishes your product from the zillion other, microbiome tests out there? I do know there are others, again, don't know the difference.
Totally. Great question. There's two main things that are really different about Evvy's test. One is that we do metagenomic sequencing. There are other tests that do PCR tests. We talked about those, right? Where you're looking for a limited
I know you're using a lot of terms and we get it. We want to make sure other people get it. How does someone know what metagenomic testing is? PCR? Explain that to folks who are listening.
Great question. So metagenomics just means you're sequencing the whole everything, right? So if you were looking at a piece of paper and you were trying to figure out what the piece of paper said, a PCR test would do a great job answering the question, is Alyssa in this document? Is Rachel in this document? A PCR test will tell you yes or no. If you do the next type of level up of testing is something called 16S sequencing. That would look at the first sentence or the first paragraph of the document and try to infer, this seems like a legal document, or this seems like an employment letter, or this seems like a fiction novel, right? So we're starting to get the picture of what's going on. Metagenomic sequencing, you're just reading the whole document. You're just saying, what is everything on this page? Tell me what % of it is positive or negative. Yeah. And so essentially, we're the first test that's actually looking at everything in the sample, which, as you can imagine, with vaginal infections, there's so many co-infections. It's so hard to know how to change the community that having all of that information is the first place we start. The second part that's different about the test itself is that it's actually validated. We've gone through CLIA validation, CAP validation, CLEP validation, and we've published peer-reviewed validation of the test and the methodology itself, which is not something that anyone else in the space has done. And then the last part I'll mention is that we also do all of the aftercare. We also make sure providers are involved in everything, that it's not just leaving people to their own, that we make sure there's a doctor who can help that patient and get them treatment and answer their questions. So I would say those are the three biggest differences.
Yeah, you know, I so appreciate this. I think there's such an issue with trust in terms of the medical world. And, patients really do want to be able to do their homework and know that what they're taking from home has been tested and validated.
Completely. And it costs money and takes time, but it's worth it.
So where are you from a business perspective? You're commercially available. You've given the test to 70,000 people. You're building your database. You're creating solutions. You're providing responses to the diagnostic so people know what to do. What's the end goal? And where are you right now in that process?
Yeah, great question. So I think in the end, we want to always have kind of two parts of our platform. One is where we're constantly able to serve patients and providers with what is the best test for this patient? How do I get the best information on her health and her body? And then how do I know actually how to help her? What is the best next step for this specific patient? And I always say that's essentially precision medicine, right? That was the promise of precision medicine. But the problem is that you can't have precision medicine for women if you have no data on women. So we very much want to enable precision medicine for women that's delivered directly to patients through providers, wherever you're going, that someone's getting better care because Evvy exists. I think on the other side, we want to enable lots of novel new targets that will unlock a whole new age of therapeutics and diagnostics in women's health. I think leveraging that data, then we can say, interesting, patients who have endometriosis seem to have all of these things in common. Is that an interesting diagnostic? Are those new potential therapeutic targets we could go after? And so long term, I think there are two really interesting parts of our business where we can continue to serve patients and providers, but then also own frankly, the downstream, all the value that comes from understanding downstream biology.
One of the things that strikes me as so interesting is I don't remember if you were at this particular meeting, Priyanka, at JP Morgan, where if you're querying a terrible set of data, you get terrible answers. So the example that people
garbage in, garbage out.
Yeah, garbage in, garbage out is they looked at some of the available data and determined that 33% of women go through menopause. So every person in the room who's doing women's health starts laughing. Well, what about the other 77%? Do they die? Like, what happens? And clearly it's a case of we don't have a strong enough data set. Given your background in machine learning and data science, is one day the hope that you will be the database that people are querying to get some of this information?
Yes, absolutely. I think it's insane that there is not centralized data on women's health. I mean, I was talking to a large healthcare data company that shall not be named, and they were basically saying, they were like, we are getting all these inquiries now, which is very exciting, about people wanting specific women's health fields. But the problem is that the EHR, I mean, you know this better than anyone, Dr. Dweck, they're not even places to put this data. No, so it's like, other than when was your last period, where else am I supposed to put anything that has to do with the fact that you're a woman? So they came to us and they were like, we know you guys collect really comprehensive data. Do you think you could augment our data set with your additional fields? They wanted to know, what's the average age that women are going into menopause? Like, they don't even have that. Nobody asks, when did you stop having periods, right? And so
we do. We do in gynecology world.
Right, but the average EHR just does not have data on
don't even get me started on the EHR. That's a whole nother issue. I'm just curious, do you see a lot of mirrors with people who are studying the gut microbiome? Because again, both men and women have the gut microbiome. So I didn't know if those are applicable to each other or have any bearing on what you're doing.
Yeah, it's a good question. I mean, the gut microbiome and the vaginal microbiome are different from a variety of perspectives, obviously.
Yeah.
I think the most important one is that the vaginal microbiome is really like clinical today. I think that the gut microbiome will be clinical eventually. I think we will figure out, but here's the thing, the gut microbiome, frankly, is just way more complicated. The vaginal microbiome is a little bit simpler. We know what health and disease look like. We know what's good. We know what's bad. It's easy to test. Doctors have been testing the vaginal microbiome for decades. They've just been using bad technology. So I always say, I think it is our responsibility as the vaginal microbiome people to bring the microbiome into the clinical sphere. I think the vaginal one will be the one to bridge that gap. And then I hope that the other ones follow behind us. But I do think
I think that's amazing. And I'll leave you with this thought because it's probably already in your pipeline, but wow, are there questions about the vaginal microbiome and the urinary microbiome and how the, association exists in the realm of UTI? Yeah. Okay.
Actually, our senior scientist was one of the first researchers to discover, or prove, I should say, not discover, prove that urine is not sterile. Forever, obviously, people thought urine was sterile. And so her PhD was on the vaginal and urinary microbiomes. And so she's always pushing us to do more on that topic. And we actually are looking at some interesting things in that space.
Fascinating. Well,
I also didn't realize, I looked again, that we have the Stanford connection, although I was there decades before you, but very exciting.
Yeah.
And I saw how involved you were. Well, we are so excited to see the success that you've had, and I've had the opportunity to meet you and see you speak, and Alyssa has a number of times. We just want to wish you, continued success.
Yeah,
it is so hard to change a conversation, and you are doing that with Evvy, with the process you're using, with the excitement you're creating. So we'll be cheering you on from the sidelines.
Thank you so much for having me. It's so good to see you.
Where can people learn more about you? Because I'm sure they're going to be very interested.
We're Evvy.com, EVVY.com. And then honestly, regardless of whether you want the Evvy test, you must go to TikTok or Instagram or wherever you get your funny content and follow Evvy, because the content that our team puts out that is truly educational about your body, but so funny, is just phenomenal. And I highly recommend.
Terrific.
On that note, thank you so much. It was wonderful to speak. Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.